Nice to meet you.
Hi, hello.
I'm Sonia. I had a double valve transplant in 2015, so when I was 17. And so for me, getting my vaccine was really important because I wanted to protect myself, being someone who has had previous medical conditions. I wanted to, and I understand that you have a connection to transplants as well.
Yeah, so my son, who is 6 years old, had a liver transplant. So he's immunocompromised. He's been in the shielded group. We've had to look after him, but also as a doctor, I work with a lot of patients who are immunocompromised for various reasons, and also for those that have had transplants as well.
Nice. I've found that a lot of young people, especially in the transplant community that I know who are immunocompromised, have been really worried about getting their vaccine.
So in our surgery, we've got roughly about 2,000 patients who were in the shielded group, and we've had exactly the same worries that everybody else has had. So routinely questions are coming up: is Dr. Arif, do I need the vaccine? What side effects will I have what side effects will I have from the vaccine? Is the vaccine safe? It's gone past too quickly. Something's come out really quickly. Yeah. Is it necessary? So those repeated questions have been coming back. And yes, I have seen hesitancy. There are still some of my patients, I'll be absolutely honest, who are not having the vaccine, even though they fall between the 18 to about 30 age group, because they want their reassurances further addressed, which is absolutely fine because it's a choice. Yeah. And I've still got some patients who couldn't have it fast enough. The minute that it was offered to them, they were there straight away. So it is very much that small but significant proportion of my patient list who are immunocompromised that I'm still trying to win over their hearts and minds.
Yeah, I think for me, myself, obviously I'm the same. I couldn't jump quick enough. So my dad also has a heart condition. So for me, it was more about getting it for myself, kind of getting my life back to normal as a young person, having like the early 20s kind of taken away from you. So the pandemic started when I just graduated from university. So I kind of never got my graduation, things like that. So for me, getting the vaccine meant that I could start that kind of my early 20s properly again. But
was there any point, Sonia, that you thought, actually I don't want it?
A little bit.
What
I must
was
admit. For me, it was around like fertility and those kind of worries I took upon myself to research and find out a bit more about before I made that decision. But as someone who has been through, I'd say, the rigour when it comes to kind of medical professionals in and out of hospital, having treatments and surgeries, it was kind of a no-brainer for me to do that, because if it was either have the vaccine and the worries, the small worries I had about the vaccine, or the huge worries that I had if I caught COVID, they outweighed each other. So it meant that I took the vaccine over the issues that I would have if I caught COVID, as someone who with a heart condition is vulnerable to having a worse reaction to COVID.
And when you did have the vaccine, what side effects did you have?
Literally nothing.
Okay,
that was literally
brilliant.
fine. I had my Pfizer vaccine in maybe February, I think, early Feb, as part of cohort 6. So as soon as I got my text, I booked on literally within 3 days, and I went to my local vaccination centre, and then went for my second vaccine. I felt a little bit sluggish maybe after my second vaccine, just like I hadn't had enough sleep, but it only lasted for a couple of hours and then I felt completely fine.
So I had exactly the same. So I have no underlying health condition, but my first vaccine was Pfizer, no side effects, maybe a sore arm. I felt very fatigued for maybe the first 2 or 3 days, but then absolutely fine. My second vaccine, I did have a sore arm, which lasted longer.
Hurt more.
And on the second time, I actually got swollen nodes underneath my armpit and in my neck, which is also something that and that's normal. That's a completely normal reaction, because your immune system lives in your arm, in your lymph nodes under your arm and up the neck as well. But again, took some paracetamol, lasted for possibly no longer than about 4 days, and then everything settled down, and then I've been going about my business, seeing my patients as normal. And I think that's the most significant thing. They're very short-lived, aren't they? Did you have any issues with your cycles at all, with your periods?
None at all.
So I'm a vaccinator, so I've been vaccinating. One of the biggest things that I've had a lot of is that, this is mostly on social media, and I've had possibly 2 patients who've come back and said my periods have become irregular. Right. We need to really understand that all vaccines, not just COVID-19 vaccine, affects our periods. Getting COVID-19 infection will also affect your periods.
And other things.
Exactly. And the reason that happens is because you have an immune response. When I give you the injection, or I have the injection in my arm, it triggers off an immune response that says, here's what the virus is going to look like. This is the mugshot of it. Your immune system makes lots more copies of it. We also have our immune system in and around our womb.
Right,
So
okay.
either it will affect your cycle, so you'll have a heavy period, a light period, but that's also going to happen because that immune response is there.
Right,
So
okay.
I think that it's really important to reassure people that it's not going to affect your periods for long. We know about it, but it happens with all vaccines, and it does not affect your fertility.
That was, I think, one of my biggest worries when I was like not considering getting the vaccine. I always knew that I was going to get it. Was always keeping an eye when it was being tested and passed and going through trials and things like that, keeping an eye on it, knowing that I wanted to get it as soon as I could. But that was, I think, my only, I guess, hesitancy was the issue with fertility. But that once I'd looked into it and really understood like exactly what you explained, and like I said, what happens when you actually get COVID, it wasn't something that I really sat on for that long, because it wasn't a huge factor in my decision. But I understand that young people do have that worries, and young women specifically, obviously that is one of their main worries. But as you just explained, it's not something that should really hold you back from getting your vaccine. And for me, the freedom, I guess, and the lack of worry that I have now, knowing that I have a vaccine, obviously still being sensible and going about my life in a very normal way that feels now, I wouldn't have that without the confidence of having the vaccine. I know I wouldn't behave the way that I am, ostensibly still, obviously, but there are things that I wouldn't feel comfortable myself doing. I wouldn't be comfortable like kind of going to the pub with my friends or going to a kind of social interaction with more than 5 to 10 people, not knowing that I hadn't had my vaccine.
I think that's a real big driver, because knowing that you're having the vaccine for yourself to protect you, to protect your loved ones around you, because we know that having the vaccine stops the spread of the virus as well. And then lastly, allow you to get your freedom back. Go to your concert, go to the pub, meet your friends as you want to do. And that's the only way that we're going to get out of this pandemic. This is one of the tools that we have. So if we can meet those 3 things all the time, then it makes almost like a
bubble.
A bubble of like, this is how we should be doing and tackling the pandemic.
Yeah.
At any point, were you worried about the safety of the vaccine?
I understand why people were worried when it had been, people say it had been rushed through, it hadn't been checked properly, happened so quick. You know, other vaccines take years and years and years to be put together and passed. For me, when I understood that, I know that we obviously overlapped different parts of the testing and different parts of production and things like that, so it happened quicker than it usually would. Also, we were in the middle of a pandemic, we were looking for a way out.
But I've got a really succinct way of looking at it, because firstly, the vaccine is safe and effective. It's the safest way to protect you against COVID-19 infection. And this vaccine, in a way, hasn't been rushed at all. So my experience as a doctor, we've known about vaccines and the behaviour of viruses since Edward Jenner came out with the smallpox vaccine. But we've built on decades and decades and decades of information about how our immune system and vaccines work. In fact, we have a childhood immunisation programme that starts vaccinating children from when they're 5 weeks old, that tiny. And when the pandemic hit, the world scientists they were able to do DNA sequencing of the virus. They gave that out to the world. We don't do that with other vaccines. Because the whole world isn't invested in it. If you're not affected by it, you're not going to be invested. And the minute that we had the DNA sequencing, the scientists, the doctors, the manufacturers, the people who need to do the distributors, the participants for the trial, they were ready and primed. So in a way, when you are funneling so much resource, not just money, but all sorts of resource into something, it made sense that it would come out in a year. Or 2 years, actually, because the pandemic had been going on for 2 years by that time. So 2 years is pretty phenomenal, yes, but it's not built out of scratch. It's because it's built on decades before of information. So that's what I would say to people who say it's come through too fast. Was there anything that said to you, why should I have the vaccine? Because I'm immunocompromised and my immune system might react against it. Was there any sort of question in your mind about that?
So for me, I'm luckily not on any transplant medication. So I had a tissue transplant. So for me, I don't have to take any immunosuppressants. But friends in the transplant community that I know and are aware of, for them, they couldn't take the vaccine quick enough. I have friends who hadn't left their houses in months and months and months, and hadn't done anything close to normal life for a really long time. I mean, one of my friends had to text me to say she went to the garden centre for the first time in 8 months because she's had a kidney transplant. So for her, having the vaccine was a huge deal. And obviously, they're now worried that because of the vaccine hesitancy in their cohorts, especially around the younger transplant community, the hesitancy in younger people means that they can't quite go about normalcy of their lives until everyone else had kind of had the vaccine to protect themselves and protect other people. And I think one of the messages that they want to put forward is that the vaccine doesn't just protect you, it protects everyone else around you. And there are people in our community, in our population, who can't have that sense of freedom and normalcy until everyone else is kind of behaving in a way that is safe for everyone else. So it's just, I guess, hammering home the message of the vaccine isn't just for you and protecting yourself, it's about protecting those most vulnerable in our communities who, if they do contract COVID, will get really unwell, and that could be really harmful for them. Whereas, I guess, I mean, myself, I am vulnerable. I did have my vaccine early, but nowhere near, I don't have the worries that a lot of my friends have who do have transplants have.
So some of the concerns that I've had from my patients who are immunocompromised are, they always say to me, will I be worse affected from the vaccine? For that, it's really important to know that it's not a live vaccine. So all immunocompromised patients can have it safely. And if there are side effects, they're short-lived, from no longer than about 7 to 10 days. But if there are severe side effects, always talk to your doctor, because then we can all, give you treatment for that. Maybe that's just paracetamol to bring your temperature down, or just get you to take more fluids, because we know that our immune system uses fluids. The other hesitancy that I've had a lot from my patients is that they've read online things that says that the vaccine doesn't provide enough coverage for immunocompromised patients, because their immune system is already fighting so many other things. Yes, that is true to a degree, but I need to put that into context as well. The most important thing is that to get the virus naturally, COVID-19 virus, it will put your immune system under so much stress that actually you'll have struggled to get over that. So therefore you can end up, if it's a cough, end up getting bronchitis more unwell, to the point where you'll need hospitalization, and it will take you longer to get better. What the vaccine does is that it allows you to have at least some protection, but what we need to do is get others around you protected to provide you protection. So it's not just you in the middle who's immunocompromised and the vaccine is just for you. That's why we're encouraging other people, healthy adults around you, to get vaccinated, because we know that you are already in the extremely clinical vulnerable group. So my son has had a liver transplant, and he is on medication that suppresses his immune system. And as a mother, I've been back and forth in and out of hospitals with him. And so this is even before a pandemic. And when he gets sick, it's like he falls off a cliff. He becomes very, very sick very quickly. So in order to keep him safe, I've made sure everyone around us is double vaccinated, because we don't want to bring home the virus, because it will be asymptomatic, you don't have any symptoms, and you'll pass it on to him.
So what would you say to people? I know that these conversations are really difficult, right? People don't know how to bring up, if they do have a family member who is hesitant, who is reluctant to get the vaccine. What would you say to those people who are immunocompromised and are surrounded by some people who actually are really against the vaccine and don't want to get it? What would you say? What advice would you give them to kind of speak to their family members to say, hey, this would really help me out?
The first thing, because I've had that as well, because I've had distant family relatives and cousins who are saying, well, I don't want to be vaccinated. And I'm saying, but you're not vaccinating for yourself, you're vaccinating to help me keep my son safe, because he's on medication so he doesn't reject his liver. That's literally a life-saving organ for him. My answer to that is, firstly, don't get angry. Because otherwise you'll end up arguing all day with each other. Don't get angry. I think tackle into what is that's making them hesitant firstly. What is that fear?
Understand the root cause,
understand the root cause of it. And if it's something that they've come across social media, then check that information through. The UN has actually given a verified way of looking at information. So why am I sharing it? Why am I sharing it? What is the source? Where did it come from? When was it published? And who made it? I think that's really important, because that's usually because there's a thread that they've come across, and then the algorithm will just keep putting you those sort of videos that says the vaccine has got trackers in it, the vaccine will affect your fertility, and that's the algorithm that you follow. And then lastly, I think that because it is a choice, is that you just have to allow the person to go away and make that decision without applying a pressure or force, because we are autonomous individuals, and allow them to come to the decision from themselves. The hope is that actually most people, like now the data shows 75% of the adult population is double vaccinated. So the public are phenomenally on our side, on board. They are really taking on board the reason for it. It's that 25% of adult population, that small yet significant amount, that we still need to change their hearts and mind.
And I guess with young people, as a young person, I guess, a lot of our information, like we said, comes from social media. So a lot of the things that we see, although we do have those kind of pop-ups that say, oh, have you checked this information is correct? News travels so fast when you're on social, and you could be scrolling on Twitter and then go on Instagram and you could see very, very conflicting things, or you'll see like false news, fake stats, etc. And all it takes is one person clicking share or clicking retweet on their timeline or on their Instagram, and then you've got another 10 people, young people, who have seen that, and they kind of, what I guess, for what I'm trying to say is that they might be hesitant because of things they're seeing online. And it's just about getting that messaging right and understanding that, and allowing them to understand that the things that have happened in the vaccine are completely safe, and people are getting it, and people have had the vaccine, and look, like the data shows that it's working. You know, we wouldn't have had this vaccine, we wouldn't be in the situation that we're in now as a country without the vaccine.
When you speak to your friends who are 16 and 17, because now they can have the vaccine, are you noticing any fit and healthy? Because we're now asking them to have the vaccine. Are you noticing any queries or questions that they're?
I guess the most hesitancy with younger adults, 16, 17, 18, maybe not so much 18, is, well, if I caught COVID, I wouldn't be that sick anyway, so why would I have the vaccine? And I think that's the kind of conception that a lot of young people are having right now, is that, oh, well, you know, if I did catch COVID, it wouldn't be that bad. It would be kind of like a cold, and I'd get over it. But obviously, we are seeing a lot of young people develop long COVID. I have 3 friends in my kind of immediate proximity who have long COVID now because they caught COVID late last year. So for them, they're over 18 and they've now had their vaccine. So I think the hesitancy I'm seeing is that they think that, as young people, we also think we're really invincible, right? We think that we can take on anything because we're really young and we're fit and we're healthy. But, you know, COVID doesn't really discriminate when it comes to things like that.
So the biggest thing that I've seen with young people is that invincibility factor, but also they say that I won't have long-term effects even if I do get sick. But I say to them, think about, you know, Epstein-Barr or glandular fever. And if lots of young people can get glandular fever, but you can be left with chronic fatigue and ME, and then they're like, oh gosh, yes, I do know a friend who had glandular fever, because it's a terrible, but that's a virus as well. So we know that long-term conditions can appear even from viruses. I'm actively seeing symptoms of long COVID in my surgery. So not just but I'm seeing in younger, like 16, 17-year-olds. I'm seeing chronic coughs, fatigue, brain fog, maybe feeling dizzy for a long time, inability to concentrate. And those can be really damaging, particularly if you know that you've got your GCSEs and your A-levels, which are the crucial bit of your...
Really busy times of your life, right?
Your informative years are going to come up. And we've already had so much time off school because schools have had to shut down. And so I think the value in making sure that we're getting our 16 and 17-year-olds goes beyond just the fact that you think you're invincible. It's because we want you to be able to carry on with the stuff that you want to do, which is go to school, get your GCSEs, get your A-levels, progress and go on with your life and not hold you back.
And I think it's reiterating the message, again, that it's not just for you. You're not just vaccinating yourself. There might be people in their year group at school who are immunocompromised, who might have other underlying health conditions, whose parent might be immunocompromised, and kind of making sure that they're aware that that vaccine isn't just protecting them, it's protecting their circle at school. It's making sure that their immediate friendship group, their friends in their bubble, in their class, you're protecting them just as protecting yourself. When you walk into that classroom, once you've had that vaccine, you're making sure that no one else in that room is going to, touch wood, get COVID either. So it's, I guess, keeping that message going that although you might feel as though if you catch COVID, you're not going to be unwell, it's about mitigating that and making sure that the worst doesn't happen.
And there are so many other vaccines that young people are having. HPV, you have that at school. You have your BCG.
We get our flu vaccines every year.
Vaccines every year throughout school. So this is going to be no different to that. And actually, it's really heartwarming because as a doctor, I've seen more young people readily wanting the vaccine, especially the 16 to 17-year-old group. I've really seen a lot of young people going, I just want the vaccine because I want to get to university, or I want to go to that concert that I haven't been able to go to. And those are real life things that they want to do. And the positivity has, I don't know what it is, recently been really overwhelmingly good for what I've come across.
Like I said, for me, I feel as though like really fun and energetic and busy 2 years of my life, like after graduating, finishing uni, kind of starting life in the adult world, I didn't really get to do. I submitted my dissertation in my parents' living room on like a random Thursday. So I think for that generation, they're very just wanting to get back to the way that things were before the pandemic, or the things that they feel like they've missed out on. And the vaccine is the way to do that, right? The vaccine is the way that you can go to that club night that you've wanted to go to for ages. You can go to the pub with your friends that you haven't seen in a year and a half. And yeah, I think that's what a lot of young people are feeling, that they're kind of getting back what they have missed out on.
Yeah, because 2 years of missing out on things,
Yeah.
it's hard. And so I feel for younger people. Like I consider myself old now, you know, I'm so old. But I do feel that there's that sense of let's just get back to normal and get back to our freedoms that we want, so we can do away with things like masks in the future, that we can do away with you know, people ending up needing ventilators because they are that poorly. So the longer out, the benefits of having the vaccine will always outweigh the risk.
The risk of catching COVID.